President Donald Trump says House Republicans need to cut spending in his big, beautiful bill, and all eyes are on Medicaid. Democrats say Republicans can't cut spending on Medicaid without cutting coverage. Republicans insist they can. 27 News Washington correspondent Vinay Simlot explains.
The House Republican budget asks for $880 billion in cuts, primarily to Medicaid, and the chairman of the House Budget and Appropriations Committees say states should take on more of the burden.
Of course, the states don't like that, but they're not running a $2 trillion deficit. We are.
We will strengthen the program and make it sustainable.
They say the federal government needs to reform Medicaid. It accounts for about $600 billion in federal spending.
There needs to be a much more equitable sharing in the cost burden.
For every dollar spent on Medicaid, the federal government contributes between 50 and 77 cents, depending on the state. 40 states expanded Medicaid under the Affordable Care Act to cover more people. Under the expansion, the federal government contributed 90 cents for every dollar for the new people. House Speaker Mike Johnson says changes to that funding scheme are off the table.
Well, that's what he says, but that hasn't been resolved.
If the federal government's share drops below 90%, the Kaiser Family Foundation says 12 states have trigger laws to automatically end Medicaid expansion. The Congressional Budget Office also estimates 5.5 million fewer people would be covered, but the change would save the federal government about $860 billion over the next 10 years.
We have no intention of anybody losing coverage under Medicaid.
Democrats say the cuts would be devastating.
Do you really think states have the capacity to help get that many people onto coverage? I don't think that we do.
The chairmen say members are still negotiating. In Washington, I'm Vinay Simlot.